Hello. Welcome to the Schuyler Center for Analysis and Advocacy's first overview of what we see in the enacted budget. My name's Kate Breslin. I'm the president and CEO of the Schuyler Center for Analysis and Advocacy. And we're just delighted to welcome you to join us in what we hope will be an informative, relatively informal conversation, reflective of the conversations we're having with each other as we try and unpack what we see in the New York State fiscal year 22-23 enacted budget. So a bit about Schuyler Center. We are celebrating our 150th year this year, and we work to live out our founder, Louisa Lee Schuyler's vision of advocating for lasting change for those who are living in poverty or who are otherwise disenfranchised. We share data and advocate for evidence-based approaches and policies for the most disadvantaged New Yorkers. Like our founder, we believe that policy can be a good tool for meaningful, impactful change. And throughout our history, we've advocated for initiatives that are now integral components of New York's approach to public health and child welfare, including tax policy. Among our proudest is spearheading the work to establish in 1994 and later increase the New York State Earned Income Tax Credit for low and moderate income households. So some facts: children are more likely than adults to live in poverty, and significant disparities exist across racial lines. Children are the poorest and most diverse segment of our society. I think we can all agree that every kid should have a fair opportunity to be educated and get off to the best start possible, and that the zip code where he or she grows up shouldn't determine his or her chances of achieving success, but it often does. Just last December, Governor Hochul signed the Child Poverty Reduction Act into law, setting the expectation that New York State will intentionally, significantly, and consistently cut child poverty with attention to racial equity year over year. Beyond that, and just as important, the law holds policymakers publicly accountable for whether and how budget and policy decisions affect children living in poverty. With our fellow advocates across the state who worked hard to see passage of this act, we are really disappointed that the Child Poverty Reduction Advisory Council has yet to meet or even be identified. So please join us in urging the governor and other policymakers to wait no longer to focus on child poverty. You'll hear today a high-level overview from our policy team about what we see in the enacted budget as it relates to children and families, and especially those living in poverty. We'll continue to hone our understanding of what's in the budget, and we're eager to hear today and going forward what your questions are as we dig into it. And we plan to release our more detailed written look at the budget, which we call the last look after the budget gets enacted. We plan to release that next week. So you'll hear today from Dee Dee Hill, Crystal Charles, and Laura Castle, and they'll introduce themselves briefly. And then, as I said, we hope this will be a good start and overview as we dig into the budget. So Dee Dee, please get us started.
Hello, good afternoon. So I'm Dee Dee Hill. I'm Policy Director at the Schuyler Center and really excited to be here this afternoon. And I am going to start by talking about childcare, one of my favorite topics. So first of all, as many of you probably know, childcare really received unprecedented attention this year in the budget negotiations. And I think that's in large part because the pandemic really laid bare what all of us who have ever, have raised young children know is that childcare is essential. It's essential for the well-being of families, businesses, communities. And what we saw during the pandemic is when many families couldn't access childcare, or childcare had to close for public health reasons, everything sort of fell apart. So here's what we sought in the budget. And when I say we, I'm talking about thousands of New York parents, childcare providers, after-school providers, child advocacy, organizations, families impacted by the child welfare system, immigrant families, immigrant rights organizations, unions. All of us came together, many under the umbrella of the Empire State Campaign for Childcare, unified in a request for $5 billion for New York childcare. And this $5 billion was intended to stabilize the system, expand access to more families, and put New York on a short path to universal childcare. There were 3 components to the ask, and all were and are essential to ensuring that we don't destabilize the childcare system, which is shaky after years of underfunding. So first component, what we sought were additional funds to expand access to high quality childcare to more New York families by raising income eligibility limits on childcare subsidies. That is the principal means by which low-income New York families receive assistance to pay for childcare. Also, part of that expansion, we sought to remove some of the other barriers to gaining access to subsidies, including work requirements and immigration status requirements. Second component of our ask was we need more funds to raise the wages, the compensation of the childcare workforce, which has long been earning near poverty wages. And then finally, we sought funds to begin to stabilize and make this system sustainable by seeking an increase in the subsidy reimbursement rate. So those were the 3 components, and here is what the budget included. It didn't include $5 billion for childcare. However, it did include new funds for all 3 components of the ask. And so first, for families, beginning in August of this year, the income eligibility cap for childcare subsidies will increase from the current 200% of the federal poverty level to 300% of the federal poverty level. And what that means, I'll give you an example of a family of 4. Currently, the income cap is about $55,000 a year. Beginning in August, that cap will increase to $83,000 a year. And we estimate that about 225,000 New York children could become newly eligible for childcare subsidies once this expansion goes into effect. For providers, the budget provides $343 million, and this is to extend the very successful stabilization fund grants that were made available to providers last year into this year, funded principally through federal stimulus funds. And these grants will start up again And we're looking forward to seeing more of the details. One other provision is that 75% of those grants, when they go out to providers, must be used for workforce initiatives. And then the final, there are a few other investments, but the headlines, the third piece of that puzzle is there are new funds to begin to build a sustainable childcare system by raising the childcare subsidy reimbursement rates from the current 69th percentile of the market rate to the 80th percentile. This is going to drive more funds to childcare providers who serve families who receive childcare subsidies. I think overall, if these budget investments are rolled out swiftly, effectively, and fully, it's going to be a game changer for many New York families and will provide some much needed support for the childcare workforce and for childcare providers. There were, of course, some disappointments, and I think probably the biggest disappointment, or certainly the one I want to flag, is that these expansions left behind many New York children, including immigrant children without documentation, and many children whose parents work fluctuating hours or work in the gig economy or the informal economy. These families, they have a really hard time proving work status or the exact hours of work, creating real obstacles to accessing childcare subsidies. The good news is that we can fix some of these exclusions in the next 2 months before in the legislative session. We have about 2 more months, and we're really looking forward to working, we hope, with Governor Hochul, with legislative leaders to bring more of these children in to the childcare subsidy system if their families need childcare. I want to just one quick note about pre-K. There is some new funding for pre-K in this budget, 125 million in increased funding. And this is going to help New York State continue its expansion of full day public pre-K to children outside of New York City. We already have universal in New York City, but the rest of the state has been waiting for some time. So this will take us a little way further down that road to universal. And there's a provision that we're still studying, but it looks like it's going to break down some of the barriers that prevent more CBOs, community-based organizations from offering pre-K. And this could be a really important step towards better alignment between pre-K and childcare, so they can both be stronger together. So I'm going to stop there. If you want more weedy details, please make sure to read our last look that will be in your inbox next week. And I'm going to pass the mic to Crystal.
Thanks. Good afternoon, everyone. I'm policy analyst at the Schuyler Center. Before I get into the budget, there's some context to quickly unpack here about child welfare. So when we talk about child welfare, what we want to talk about is strengthening families, connecting them with the resources they need to stay together and thrive. Looking at the existing child welfare system, typically families are brought into contact with the system if there is a report of abuse or neglect. That leads to Child Protective Services investigations, including pathways of preventing a child from being removed from their home. In the event a child is removed, we also look at the rates of placement in institutional group care or family-based care, ideally with kin, or people who have a pre-existing relationship with the child, like a relative. The child welfare system has persistent racial disparities in each step of this process, even in the worst case scenario where youth reach the age of 21 when they must transition out of the state's care. This year in the budget, there was a historical opportunity for New York State to correct over a decade of underfunding in major child welfare programs. Our first priority was to secure an increase in the state's investment in child welfare preventive services, which are provided to help keep children safely at home and include childcare, home visiting, and housing subsidies. These services were up for reauthorization this year and are required by statute to be funded by the state at 65%. However, they have been funded at 62% since 2008, leaving counties that are often stretched financially to have to bear more of the costs for these programs. Another priority was to secure state investment in updating foster parent reimbursement rates. Foster parents often spend much of their own money to support the children in their care. The rates at which the state reimburses these expenses have been stuck at the same level for over a decade. A few months ago, the state was required by the terms of the settlement of a lawsuit to modernize these rates. A third priority was to restructure the funding of the Kinship Guardianship Assistance Program, or KinGAP, which financially supports kinship caregivers that provide permanent care for children and youth, allowing them to transition out of state care with family. The funding for this program is currently inside the foster care block grant, which funds many of the programs for children under the state's care, including institutional placements. KinGAP, as a long-term program focused on supporting permanent kinship care for children, should be funded in an open-ended manner, similar to other long-term child welfare programs that enable children to leave foster care with a permanent family. Overall, in child welfare, this budget was a missed opportunity. Preventive services were reauthorized for 5 more years until 2027. However, the state's share of funding for these programs was not restored to 65%. The state cut its share down to 62% during the 2008 recession, and it has never been restored. Even this year, with an estimated $4 billion surplus, the state share of funding was not restored. New York State does not fund the modernized foster parent reimbursement rates, leaving it completely on counties to bear. This lack of state support will strain counties' ability to support other child welfare programs. KinGAP remains funded within the foster care block grant, limiting expansion of the program to kinship caregivers. We are entering a second decade of underfunding in crucial child welfare programs at a moment when New York children and families need stronger, better funded services. One of those services, a housing subsidy, has not been updated since 1988. It currently provides $300 a month to support rent payments to prevent family separation for children and families, and housing instability and homelessness for youth leaving foster care. In order to modernize this housing subsidy, the state should provide at least $725 a month and update the amount yearly as cost of living rises. Kate, back to you.
Thank you, Crystal. I'm going to turn now to family economic security and specifically tax credits. So we know that raising children is hard even in the best of times, and especially for families without an economic cushion or without others nearby and without a strong social safety net. And the pandemic really laid bare the precarious economic and emotional stability of so many families. Income transfers to families, even modest ones, can improve outcomes for children in all areas of their well-being, health, educational attainment, and future earnings. So a bit about the federal child tax credit, which we've talked a lot about, and I think folks have heard a lot about, that was from last year. Before last year's historic and temporary improvements, the child tax credit was structured in a way that denied the poorest children the full benefit because of the way tax policy works. It, where it starts to phase in makes a difference, and then how it phases in. So typically, just to give a little background on some of these credits, just like any tax that we all pay, income tax, that it starts at a certain threshold, and then it moves as income goes up or down and then cuts off. And so the federal child tax credit doesn't start until a family's already earning a pretty decent amount. So it already excludes the lowest income folks. And last year's expansion of the child tax credit that got to more families and increased the amount and further increased the amount for very young children for very evidence-based, all very thoughtful reasons, showed what a big difference it can make in both a family's life and in our poverty statistics if we're more thoughtful about how we use those income transfers. So the way I'll turn now to what we saw in the budget and at the state level. So just to give a very bit of a background for those who aren't always tracking these policies, typically the way the state tax policy works for the child tax credit and for the earned income tax credit is it's a federal policy, and then in each of these cases, the state decides whether it's going to implement its own version. So there's a federal policy, and that's the federal tax. And then at the state level, New York State has opted to choose a percentage. So it's based on a percentage of what the federal amount is. It's so relatively straightforward, but it can feel tricky, which I just thought I'd kind of put that overview in there. So New York's Empire State Child Credit, or Child Tax Credit, which is a credit that goes to families with kids. It provides eligible taxpayers, so those who are at certain income thresholds, because it phases out at higher incomes, a credit equal to 33% of the federal child tax credit at a level that existed prior to 2018. Or $100 per qualifying child, which is greater. In New York State, our child tax credit is only for children age 4 to 17. It excludes children ages 0 to 3 when they are most at risk for the harm that poverty can inflict on them. The enacted budget, New York State's enacted budget this year, does not expand the child tax credit to children under 4. The enacted budget does include a one-time 1 year supplemental child tax credit alongside the current child tax credit for the 2021 tax year. So that's the tax year that just passed, for families with children age 4 to 7. And it's phased in depending, so it's a higher amount for those at the very lowest income levels. And you'll see it in our write-up next week, the detail of it. I don't think it's kind of useful to get into the percentages, but essentially this 1 year, one-time supplemental tax credit continues to exclude kids under 4, but it does try and get more money to the lowest income people. And the amount kind of gets the amount per family gets smaller as income rises. And so it's good news for this 1 year. It's available only to families who have, who file in a timely way. And then, and we're not sure yet, we will have conversations to try and understand how our State Department of Tax and Finance is going to implement that. We're just not sure yet. The earned income tax credit, also a federal tax credit that New York has then taken and created its own. It's one of the best ways to make work pay for low income families and individuals. And Research shows that children of EITC recipients are healthier, they do better in school. The state's earned income tax credit provides eligible taxpayers a refundable credit equal to 30% of the federal EITC, and non-custodial parents are also eligible for a credit. A number of people who would benefit from the credit are excluded, including young childless adults aged 18 to 25. So exactly at a period when in their lives when they're most likely to be struggling, building a nest egg, that sort of thing. And immigrant filers are also ineligible. The final budget this year includes a supplemental enhanced New York State earned income tax credit for the 2021 and 22 tax years. It'll be a supplement equal to 25% of the current federal EITC eligibility. And again, eligible individuals and families can receive the supplemental payment only if they file a timely tax return, and that's for 2021 tax year and 2022 tax year. So looking ahead, we'll continue to work to make sure that children on the child tax credit, that children under 4 get included in that credit, because it's really just sort of a policy that flips logic on its head, that our youngest children are excluded from that. And we'll continue to seek an increase in the amount of the child tax credit, as well as the earned income tax credit, and looking at making sure that the phase-in levels really do get to those lowest income people, and that we include all those who would most benefit. So now I will hand off to Laura Castle from Medicaid Matters.
Hi, thanks, Kate. Good afternoon, everyone. Medicaid Matters is the statewide coalition representing the interests of people who are served by Medicaid in New York. We've been around since 2003, and we are housed here at the Schuyler Center. As we are a broad-based coalition related to Medicaid, we dive into as much of the Medicaid and health budget as we can, and we're still doing that. But I'm not going to get into a tremendous amount on hospital issues or issues related to long-term services and supports today. I want to just hone in on a few things related to children in particular, children and families. Our vision, of course, is that everyone in New York, no matter their circumstances, no matter their needs, have access to public health insurance programs if they don't have some other way of having insurance, like through their employer. And we have made a few small advances, not small to the people who will access them, but a few small advances in this year's budget that will make a real difference to children and families. The Child Health Plus program is one of the most successful public health insurance programs, I would say, in the country, certainly in New York. It covers children up to 400% of the federal poverty level. And in this year's budget, we were able to achieve elimination of the $9 monthly premium for certain families, for certain children whose families are at a certain federal poverty level, around 225% of the federal poverty level. The data on this is really remarkable. The pre-pandemic data shows that there were nearly 70,000 children who cycled off, they fell off of Child Health Plus because of their family's inability to pay the $9 premium. That is really astonishing. And to think that eliminating that $9 premium means that those children will no longer be at risk of losing their coverage through Child Health Plus is a huge win. We also have a remarkable expansion for post-pregnancy coverage. Currently, Medicaid covers post-pregnancy for 60 days. In this year's budget, New York has enacted a full year of Medicaid coverage post-pregnancy. That is fantastic. It means that people will not fall off the program at a critical time. You know, very often the post-pregnancy phase is called the fourth trimester because it is so critical to the child's health and the parent's health. And so to keep parents on cover, to keep the birthing parent on coverage for a full year is really, really critical. And an important component of this is that this coverage will continue to include undocumented immigrants. So full year Medicaid coverage for all, including undocumented immigrants post-pregnancy, another big win. We're also diving into a lot of the details in a few different parts of the budget as it relates to behavioral health services. As we know, youth mental health has reached a crisis level. We are seeing levels that we have never seen before as it relates to the lack of access to children's and young children and youth access to mental health services. This budget goes a long way, again, in a few different areas, both in the Department of Health budget, in the Office of Mental Health budget, to make sure that services will be available to children who are seeking mental health services. And that includes some expansion in Child Health Plus to match some of the benefits of Medicaid with Child Health Plus. In other words, there are services that are covered by Medicaid, but not in Child Health Plus. And Child Health Plus, remember, is the coverage for families for children whose families make just above Medicaid income eligibility. So those are some of the wins that we've seen in this year's budget. And as I said, Medicaid Matters aims to cover all areas of Medicaid and health, the Medicaid and health budget. And you can find out more on our website, medicaidmattersny.org. You can also follow us on Twitter at MedicaidMTRSNY. One of the things as we set our sights on what we're looking to accomplish next, I would like to mention that there is a bill that we're hoping will pass. It was not included in this year's budget, but it would provide Medicaid continuous eligibility from 0 to age 3. That would be a remarkable way to make sure that children at the most critical developmental stages of their lives before age 3 would be covered by Medicaid continuously. They would not have to be recertified until the age of 3. We are hopeful that that is something we can accomplish in the not too distant future. So with that, I will turn the virtual mic back over to Kate.
All righty, thank you. Right now, our team is diving deep into the enacted budget. We've been doing that for the last several days. And we're preparing our last look publication, which it's our last look at the budget. It's not really, we'll keep looking at it, but and that'll be examining the details of the enacted budget. So look for that next week. And just a reminder that we're celebrating 150 years of advocacy, compassion, leadership, and partnership with many of you. And we're having a party on May 11th to celebrate that. It's the actual date of our the signing of the papers that incorporated SCAA, May 11th, 1872 in New York City. And so join us on May 11th, but really also join us as we, gear up for the rest of the legislative session and as we gear up for securing resources that we know children and families in New York need in the future. So thank you. And we hope to see you all in person soon.